Hi guys, hope you're all keeping well. Today's video is going to be on hand, foot and mouth disease, so a short overview of this condition because again it's very commonly seen in primary care and in children's A&E departments, and it's also something which is commonly tested in exam questions in terms of written papers as well as practical exams. So in terms of hand, foot and mouth disease, well, what essentially is it? It's essentially when you get these little vesicles or papules that start to form on the hands, the feet and the mouth. But don't be confused by the name, because although it's hand, foot and mouth disease, it can affect the limbs. So you can get these vesicles can appear on your arms and legs and so forth. So in terms of what causes it, the commonest cause is Coxsackie virus, and specifically Coxsackie A16 virus. And there can be other variants of the Coxsackie virus that can cause hand, foot and mouth disease. And there is a very rare but more serious virus that can cause it, and you should be aware of this. And this is the enterovirus 71, and that can cause much more serious hand, foot and mouth disease, where the child is very poorly with the virus. So why is hand, foot and mouth important? Well, it's important because we see it so frequently, and actually if we're not careful, children can get complications with the condition, and the complications, the classic ones that we should be aware of, are dehydration. So you'll have a child who has the features of dehydration, like increased skin turgor, dry mucous membranes, not passing any urine, quite drowsy. You can also get secondary bacterial infection. So that's when these vesicles and these papules start to become red, inflamed, and may start to discharge pus. And of course, very rarely you can get neurological complications, and that's when the virus spreads to other parts of the body, like the meningeal tissue or the brain tissue, and you can get encephalitis and meningitis. So it is important that we keep an eye out for this condition and manage it, or diagnose it and manage it appropriately. So how would a child classically present? Well, typically they will get fevers, and they can be as high as 38, 39 degrees. And they may have general upper respiratory tract infection symptoms like a cough. They may quite a runny nose, sometimes complain of tummy pain. They may not be eating as well as they normally do. And within 1 to 2 days, you start to get the oral lesions. And it's interesting because it's called hand, foot and mouth disease, but actually the oral lesions tend to start to appear quite early on. And then not long after the oral lesions appear, you start to get the vesicles and the papules on the hands and the feet, and sometimes on the limbs as well. So it's important to be mindful of that. As always, of course, we examine the child. You're looking for signs of sepsis, you're looking at their hydration levels, and you should always still do a general examination. So you're looking at obviously the throat, the neck, the ears, listening to the heart sounds and the chest, and then coming up, looking at the actual rash itself as well. In terms of managing it, so simple things that are very effective in terms of hand, foot and mouth is that firstly we should encourage the parents to provide regular fluids to their child. Little and often is the key, as long as they're still passing urine, they're still wet around the mouth. So keep the fluids in. Soft foods help when there's oral lesions, because the child will be reluctant to eat, especially if they're painful. Symptomatic control, so paracetamol would always be your first line option, but you can add in ibuprofen if needed, at a later stage if the paracetamol is not effective. And remember, we're always talking about the age group, so over the age of from 3 months onwards is when we can start to give paracetamol. In terms of sort of school exclusion and so forth, well, the NICE guidance actually says this is not necessary. So the child does not need to be excluded from nursery or school or any play groups. And the only reason for us to exclude a child would be if they're really, really unwell and they can't attend, which would be a different reason. But you wouldn't just exclude them because they've got the classic features of hand, foot and mouth disease. And the last thing to remember is that it's important for any child with hand, foot and mouth disease to avoid any pregnant women, because there is a risk of transmission there. So it's very important that it could be that mum's pregnant, it could be that an auntie's pregnant, or some friends are pregnant. So always advise them to kind of keep a distance and avoid close contact. If there has been close contact, and especially if we're heading further into term, so so we're close to delivery, then the case should be discussed with the obstetric team and they can provide further guidance. Hope you found that useful, guys. Keep an eye on the NICE CKS hand, foot and mouth disease section for more updates on this topic. And we've got lots more videos for you if you're preparing for med school finals, the PLAB 1 or PLAB 2 exams, the GP stage 2 entry and stage 3 entry exams, and as well as the MRC, GP, AKT and CSA. Whole host of videos on YouTube, on our Instagram page, Twitter page, as well as our Facebook page. And I've put the links below for you. So hopefully we'll catch you soon, and take care and stay safe.